Hey everyone, this is my 3 years on T, 2 months post-op top surgery update. It's a bit of a mouthful. I'm a little, like a week, I think, maybe a little bit more after the 3 years on T, but I kind of wanted to morph this all into also the 2 months post-op so it can all be done in one video, which is kind of nice. So, yeah. There really haven't been like I don't know, changes have been a bit slower now between like the 2 year and 3 year mark. So I'm just going to hit up kind of like stuff that I talked about in previous videos and kind of, just talk about that stuff. So the first thing I have is my voice. It hasn't, if anything, it's actually gotten a little bit higher. It hasn't gotten lower that much. Because I've been noticing some notes that I couldn't really sing like as low as I used to be able to. And I actually was talking to one of my friends who are vocalists, and they were saying, yeah, that actually happens where like, even with cis guys, like once your voice drops, it's like a really big, fast drop kind of thing going on. And it's like that for a little bit, but then it goes a little bit higher after that. So it's kind of like a regulation thing. So I guess this is kind of like how my voice is supposed to be normally, which I'm fine with. Like, I don't really care. If anything, it'll get lower if I end up getting a hysterectomy, which I probably will. But for now, yeah. So that's my voice update. The next two things I don't have very good examples of right now, just because I kind of screwed up on that. But as far as acne goes, it's been doing a lot better this past year. I have a bit like right here and around here right now. And that's just because I was really lazy and forgot to refill my prescription for like a week. So I was kind of off it at that point. So that kind of caused a little bit more going on. But it normally looks a lot better and makes me really happy because I've been dealing with a lot of that being really extreme, at least between like first year and second year of T. So that's great. The other thing that I can't really show very much is facial hair, which I had a lot going on. I hadn't shaved. Well, okay, so I think sometime in January I was like, you know what? I'm gonna do the 2 month thing where you grow out a beard for like 2 months, and then or facial hair, and you can't like trim it or like shave or anything except like this lower part, and that's how you grow a real beard. Which not that I actually believed it, but I was like, you know what? It'd be fun to go do it for like two months or whatever. So I did. And then I was like, wow, this is a lot. I'm gonna kind of trim it. So I trimmed it after that, and it was looking really nice. I was kind of growing it out more around here and like keeping this a little bit shorter than this. But then my mustache started like going down a little bit into my mouth, and I was like, you know what? I'm gonna kind of trim, like cut this with like hair scissors or whatever to make it a little bit better and not like in my mouth. And I screwed that up. And whenever I screw things up like that, I'm always like, fuck it, I'm just gonna shave it all. So that's what I did today. So if you guys want like real pictures of how my facial hair is normally, just look in past pictures because that's usually like what it looks like. I'm definitely growing it back. This is a very short amount of time that I'm gonna be clean shaven because I really don't like being clean shaven at all. That and shaving like does irritate my acne, so that's been something that I've kind of stopped doing. But yeah. As far as body hair goes, that's probably one of the biggest things that I've gotten this past year is just so much more body hair. Which again, today is not going to be a good example of because I trimmed it very recently. But like especially like chest hair was just like a lot, which honestly I'm a fan of. I was like, oh, it looks manly. I love it. But it was getting a little long, so I trimmed it a bit. But yeah, I just have a lot, especially like I have some on my back, which isn't like a lot, but I definitely like I keep it trimmed. Eventually, I want to go get it waxed, but like one, I have to find a place, and two, I need to have the money for it. I would assume it's expensive. I'm really not entirely sure. So yeah. So as far as muscles, going to the gym, fat redistribution, that whole thing. Long story short, there was a period of time recently where I was going to the health center to get my shots of T, and 2 of those shots they ended up giving me double the dose. And I was like, ah, whatever, like that's really annoying and not good, but I don't think it's really affecting me that much. I was wrong. Um, a little bit afterwards, all of a sudden I was kind of gaining some weight, and I was like, what's going on? Like, I'm eating the same, I'm like being the same active wise, and then I realized it was probably because of that. So, my fat redistribution stuff is kind of, well, that's also still working on it. Like, I know that's one of the last things to really happen is the redistribution from like more feminine fat uh, to like more masculine. So, I'm still kind of in the middle of that. And I can definitely notice it, but it's not awful. It's just something that I can notice, and I want to get fixed. So I've been going to the gym, and I'm actually doing it for real this time, where I'm gonna like keep up with it because I have the time this summer, hopefully. Um, and combine like I have my routine and everything set up. So like combine muscle stuff with like running on a treadmill and biking, and it should be fine. But like we'll see where that goes. Um, yeah. So last but not least, the 2 months post-op top surgery. Uh, I've been doing a lot better. I'm completely healed, like externally at least. It still kind of feels like a bruise. Like I was carrying my cat yesterday actually, and he like just shoved his paw here, and I was like, oh, don't do that, don't do that. It hurts. But externally, I'm fine. Like I'm completely healed. My nipples have not fallen off, which is great. So this is kind of how my chest looks 2 months post-op. So yeah, it's like a lot. I don't know. It's super flat, and it's still super flat. But I also like I don't know. There's more here now, which is nice. I also think that like my scars have gotten a little bit. Well, they're not super thick, which is great. I'm trying to think of like a way to sit that. Okay, we'll just kind of sit up like this, I guess. But yeah, I had my first time swimming shirtless almost a week ago, which was cool. I went to a place Ithaca, New York, which had a lot of cool like waterfalls and stuff, and like we kind of just swam around there. I didn't really swim because it was a little too cold, but I waded and I was shirtless and like it was great. Um, yeah, I don't know. So I couldn't be happier with like the results right now. Oh, I guess, well, for gym purposes, this is what it looks like when I flex right now, which is pretty cool. Um, I mean, I really haven't been going to the gym very much these past few months, really, because of the semester and stuff. But again, I'll be keeping up with it more. So here's hoping that it, like, I'll just look a little. I just really want abs so badly, so I've been trying to eat healthy and stuff like that. So, um, yeah, but that's pretty much it for my 3 years on T, 2 months post-op. So, maybe at some point now that I can do this whole recording videos on the iPhone thing, I'll maybe be updating more often, but we'll see. So, if not, just look for Tumblr. I'll be putting some stuff up. And yeah, I'll talk to you guys later.